Welcome everyone to Compliance Best Practices for Required Group Health Plan Notices. Thank you all so much for joining us. Our speakers will be answering the questions you send through the Q&A today. We will try our best to answer all of your questions, but if for whatever reason we're unable to get to your question today, please follow up with your advisor for further assistance. Today's presentation is being recorded. We will be sharing the recording in the follow-up email and on the NFP website. If there are any portions of this call that you missed, by Monday you'll receive an email with a link to the full recording. The PowerPoint slides used during this presentation will be shared in the same email. At this time, I'll turn it over to Yoko Yoon, Vice President of Benefits Compliance at NFP, and Chase Cannon, Senior Vice President and Deputy Chief Compliance Officer and Counsel of Benefits Compliance at NFP. Chase, the floor is yours.
Thank you, Amber. Thanks so much, everybody, for joining today's webinar. We're so excited you're here with us. And as usual, we're always excited to talk about compliance and different compliance topics. And in particular, today's topic relating to federal group health plan notices. And so thanks for taking the time. As usual, we like to start off with a little bit of a disclaimer that the following is intended for informational purposes only and is not intended to constitute tax or legal advice. And any question of application of the law should be addressed to legal or tax counsel. And the information is current as of September 18th, 2024. So we're really excited to jump in on the agenda here and talk about this. I did want to say right up front that today's webinar and some of the resources that we'll be talking about, and we do have some great resources at the end of this that we'll show you, and some screenshots, and can be available through your NFP consulting team. But right up front, we just want to say this does relate to federal group health plan notices. We're not going to be covering any state required notices. We always have that challenge with state law and the increasing spider web is what I like to call it, but the web of intricacies that come with different state laws that could potentially apply to you as an employer or to the group health plan. So today we'll be focusing on federal law. But we're going to start off with a new notice and a reminder, and then we're going to walk through the notices that are required. We're going to do it based on situation, and the situation generally follows the life cycle of an employee. And so we thought this is the best way to sort of break this down and to talk about the different times throughout that life cycle that sort of apply, and then which notices go at each of those snapshot time points. We're also going to talk about distribution methods. This is a big question that we get on mail and hand delivery, and then more and more obviously as we get more technologically advanced, how do the electronic distribution rules apply? We're going to go through a couple of FAQs that we see, some penalties, and then we'll talk about resources and key takeaways. I did want to say right up front that one question that we get so often, and wish we had a perfect answer for this, but we kind of get this question of, can't we just put all of these notices into one packet to send out to our employees at one time and kind of check the box with one, all these notices that we're talking about, or most of them are going to employees. Why can't we just throw them into one huge PDF or some other packet or envelope and send it off to the employee and be done? And so we just want to say right up front, unfortunately, unlike the one ring to rule them all in the Lord of the Rings, there is no one ring to rule them all here in the group health plan notice context. And so we'll talk a little bit about why that's the case. The notices, and just at a very high level, the notices are required to go at specific times. And sometimes we'll hear the argument, why can't we just send more than is required at certain times? And the reason there is because it could be confusing and misguide employees if they are receiving notices at the wrong times. And in some instances, the notices could be seemingly granting rights and privileges that really don't attach. And so that's another reason why the notices may have to go at certain times. So although we would love to have one ring to rule them all, or one packet that was the ultimate packet you could send, we're just trying to upfront to say that's just not quite how it works. And so we'll go through the best we can with the life cycle of the employee and sort of those times, and explain the notices that can be distributed together at those certain times. And basically, it kind of breaks out into about 5 buckets or 5 different times during the employee life cycle. We'll share which notices can go at each of those times. But just wanted to say that up front. We wish we had one ring. Unfortunately, we don't. And so with that, I'm going to turn it over to Yoko to walk through a new notice requirement that's there and an important reminder before we get into those life cycle snapshot moments for an employee. Yoko?
Great, thank you, Chase. Thank you for joining us today. And the first new notice that we would like to highlight is a fixed indemnity notice. That agencies have finalized the rules earlier this year, and that created a new rule that had been applied to individual policy, but now applied to group fixed indemnity coverage. So what this is that, and this will take effect from plan years beginning on and after January 2025. So for calendar year plan, this new notice will be effective from 1/1/2025. However, this notice needs to be provided before the enrollment. So this open enrollment time, you may need to coordinate ahead of time with the carrier who's going to provide this notice on behalf or not. So basically, this notice is that plan sponsors, if you offer group hospital indemnity or other fixed indemnity accepted benefits coverage, so that indemnity coverage that only provides like cancer only policies or other hospital coverage that only provides for the income replacement. So pay by the visit, pay by hospital stay a day, and not unrelated to the medical care. And the individual employee who receives the benefit has get to decide how they want to use it. So the payment doesn't go to the hospital or the provider, for example. And for those fixed indemnity accepted benefits are not subject to many of the laws because they are not providing medical care. Therefore, the agency require employers and the carriers to provide a notice for individuals during the enrollment time to make sure to inform them that the coverage does not provide medical care, so that they don't have the expectation of what this coverage is entail. And then the requirement, there's no model notice for this, but as you can see on the later, the bottom part of this slide, the requirement is that it must be prominently displayed this notice in at least 14 font, first page of any marketing application enrollment materials, could be paper or electronic format at the enrollment time before they actually enroll. So it's in the absence of clear guidance, we're still waiting for the clear guidance for whether this needs to be provided every time or one time is enough. But in the absence of guidance, we believe that it's best to work with a carrier who provide a fixed indemnity coverage to see like whether they will be providing this notice, new consumer protection notice on behalf of the plan. So the first step is to coordinate with them, and then if they are going to satisfy, coordinate with how that notice requirement apply through your enrollment platform. So that the bottom line is that enrollees those individuals who apply for the coverage need to be informed of this consumer notice at the end. Okay, the next reminder, it's been around for a while, but more employers kind of switching from the traditional medical plan to ICHRA. We thought that this is a good time to remind those employers, maybe this is the first year thinking of implementing ICHRA for the 2025 plan year. So one of the ICHRA requirement for you as an employer to sponsor is that you need to provide ICHRA notice. And there's a model notice for this, and then we included the link at the end and the screenshot on the top right. And this notice is an annual notice and need to be provided to the eligible employees, generally speaking, 90 days before the beginning of the ICHRA plan year annually. But only for the first year, sometimes it takes the plan is not finalized until like very close to November or December for the calendar year plan. Therefore, only for the first year, they provide a grace period, and the deadline is you need to provide by the first day of plan year if that ICRA is set up closer to the plan year date. And this also notice also need to be provided for the mid-year election, could be the qualify event, newly enrolled individual, or I mean, newly eligible employees, new hires. So this needs to be provided in the mid-year as well. Okay, the next slide. And hand it back to Chase.
Thanks, Yoko. And just really quickly on the fixed indemnity notice, we're talking about policies like AFLAC, Yoko, and sort of critical illness,
Right.
ancillary lines.
Mhm.
We've had a couple of questions come in, kind of what do we mean by fixed indemnity?
Yeah, good point. Yes. So that's like a AFLAX plan or critical illness hospital cancer only coverage. So
Uh,
those that pay per visit or per day, generally speaking, provided directly to the employee, and then not related to the actual medical care or cost that associate with that visit. Chase, anything to add?
No, I think it's important to say a couple of those that we're talking about. So thanks for clarifying that as well. So with that in mind, let's move into, and thanks Yoko for going through the new notice with the fixed indemnity and the reminder on the ICRA notice. Now we're going to go into what we were talking about with the employee life cycle and sort of talk about which notices should be going at which times. And we're going to start with notices that should go upon hire or initial eligibility. And we kind of lump these together because oftentimes employers will have initial eligibility happen upon hire or shortly thereafter, right? And so on the right-hand side of this slide, you'll see which notices need to be provided. And then on the left side, we're going to go through a couple of tips to think about with respect to a couple of the notices and just generally in this time frame. And so the notices there on the right, we broke those into two categories. One is to all employees. And again, this is regardless of whether they're eligible. Actually, it needs to go upon hire. The first one is the notice of exchange. We're going to look at that one just in a second here. But that one has to go to all new hires, including those that wouldn't be eligible for benefits, and needs to go within 14 days of hire. So that's an important one to distinguish here. And same with the FMLA general notice, that would need to go to all new hires if FMLA applies. And so again, might not apply depending on your size, but if FMLA applies, you have that one to all employees. And then you have kind of the list here of the notices that need to go to benefit eligible employees. That would be the SBC, that's the summary of benefits and coverage. Usually the carrier or TPA will have that one prepared for you. The CHIP notice is the Children's Health Insurance Program notice. The HIPAA notice of special enrollment rights, Medicare Part D, creditable or non-creditable. We're going to talk a little bit about that one in a minute. There's a couple of notices that apply if you have a wellness program. Again, wellness, we'll talk about that in just a second, but there are two different notices there, an EEOC notice and a notice of availability for a reasonable alternative standard. Again, we'll talk about that in just a sec. And then Yoko covered the ICRA notice. So our tips here, again, the notice of exchange needs to go to any employee. Benefit related notices can be appropriate upon hire here, but maybe not all of them. And again, that depends on whether you have a wellness program. Maybe that one is not necessary if you don't have a wellness program. And the timing here, for example, providing an open enrollment guide to all new hires would only be appropriate if all new hires are actually eligible for benefits. So just that idea of trying to get the notices to the right people, the right employees. The FMLA general notice, again, that is in addition to displaying a poster. Covered employees really have to provide each employee with a general notice about the FMLA. Usually that would be through an employee handbook or a leave policy, sometimes includes that notice. and that usually goes upon hire. So on the next slide, we're kind of looking at the notice of exchange. Some screenshots here just to give you an idea of what that one looks like. And many of these notices come with model notices from the government. And so what you're looking at on the screen here is the governmental model notice. Kind of the idea here is to tell employees that they may have alternatives to the group health plan through the health insurance marketplace. We sometimes refer to those as exchanges, which is why it's called the notice of exchange. So just trying to give you an idea of what that one looks like. And again, that would go to any new hire, not just benefit eligible new hires. The next slide, we are looking at our wellness program notices. And again, this would only come into play if you had a wellness program. And there's a couple of different notices here. The first is the HIPAA notice of availability of reasonable alternative standards. So the easiest example here that I like to use is talking about a smoker surcharge, but it could really be any type of program that is considered health contingent. What does that mean? That means that you're asking for some type of information or test result that is going to be determining whether an employee has to pay more or gets a contribution from the employer to the group health plan based on the outcome of that sort of question that the employer is asking. So in the smoker surcharge context, you're basically saying, if you're a smoker, you're going to pay a little bit more. And if that's the case, now you have to provide what is called a reasonable alternative standard. In the smoker surcharge context, that would be a smoker cessation program. That's an example. If the employee goes through that smoker cessation program, they have met the reasonable alternative standard, and that means that they qualify to have that surcharge removed. That is true even if the employee took smoking breaks through the smoking cessation program and never quit smoking. That's just how the rules are written. If the employee goes through that reasonable alternative standard, they qualify for the same rate that a non-smoker would pay. But again, it all comes back to this notice. One of the requirements is under HIPAA here is to provide this notice. And that notice needs to be in all plan materials describing that health contingent wellness program, in our example, the smoker surcharge program. And that notice has to describe that reasonable alternative standard or the possibility of waiving that standard. So there's a couple of other requirements there that need to be in the notice. Again, model language is available for this notice, so we don't want to scare anybody here. You can get the language and put it in and plug it into the notice packet here. It's just the idea that if you do have this type of health contingent program, you also have the obligation to provide that notice. The EEOC wellness notice is a little bit different. Again, has model language, but really this one comes into play. Again, this is a different law than HIPAA. This is the Americans with Disabilities Act. The EEOC is that Equal Employment Opportunity Commission, and a different requirement for a different notice if the employer is asking about any health information from the employee. So that notice is to employees informing them what is the information that will be collected, how it's going to be used, who's going to be receiving it, and what will be done to keep it confidential. So again, think about it as in the context of an employee. If your employer is asking you information relating to a health status, you would want to make sure that you knew what was happening to that information. That's really the idea behind the EEOC wellness notice. So examples here are health risk assessment. Again, even if the outcome of that health risk assessment or a biometric screening, even if that's not impacting the rate or like a smoker surcharge, even if it's not a smoker surcharge, you're just asking that information, you still have to provide this notice. So a little bit of a difference of what triggers the two notices here, but really important to make sure if you fall under one of these two programs with your wellness program, you would want to make sure this notice gets into plan related materials. Both of them have model language, so that makes it a little bit easier, but that's the idea between those two. Okay, with that in mind, let's move to the second sort of bucket that I like to call it. We had upon hire or initial eligibility, and now we are talking about, okay, this particular employee has decided to actually enroll in the plan. And so we have initial enrollment, because that is usually relating to the first time the employee gets in, which oftentimes, majority of the times is around new hire, but also a mid-year enrollment. So think about a spouse enrolling mid-year. Some of these notices need to go to that spouse, and that's our first tip here listed. The COBRA initial notice would need to go to a newly covered employee. At a mid-year enrollment, that could include a covered spouse. So think about a mid-year marriage. That new spouse would actually need to receive that COBRA initial notice as a new enrollee in the plan. And then the right side here lists the notices that need to be provided at this time. You'll see a couple of duplicates like the SBC there, but you'll also see several new requirements, including the SPD, that's the summary plan description, our COBRA initial notice, HIPAA notice of privacy practices. That really comes into play for a self-insured plan. In the fully insured context, usually the carrier is going to be providing that. While we're talking about that one, that notice of privacy practices needs to be updated by February 16th of 2026. There is a new part to the HIPAA privacy rules relating to reproductive health care, and there's information that needs to be added to the notice of privacy practices. So just a note on that. A lot of these other requirements for notices are usually actually included in the SPD. Remember this, the SPD, that's the summary plan description. That's sort of the summary of the plan document under ERISA, and it is required to have certain information in it. And so Women's Health and Cancer Rights, or WICRA language, Newborns and Mothers Health Protection Act, those are laws that are giving rights and privileges to covered individuals. For example, under the Newborn and Mothers Health Protection Act, guaranteeing certain hospital stay lengths when you have a baby. Language saying what those rights are needs to be in that notice that we refer to as the Newborn and Mothers Health Protection Act notice, but is usually included in an SPD. So if you have somebody preparing a wrap document or a plan document with an SPD, usually that language would already be built into the SPD. So we tried to note that here as a way to say that notice is probably already included in the SPD. If you're distributing the SPD, again, within 90 days of participation, then you're going to be satisfying the Newborns and Mothers Health Protection Act or the Women's Health or any of these other notices that would be in an SPD. Again, we have patient protection notice. We have those wellness program notices. Not many grandfathered health plans still exist, but if you are a grandfathered health plan, that's a very important notice to have here to somebody who enrolls. And then we had the ICHRA and fixed indemnity coverage notices that we've already talked about. The last one I wanted to mention here is the SMM, or a summary of material modification, or a summary of material reduction in covered services. This is the idea that if you have changed benefits mid-year, you have to communicate those changes. Usually the changes that occur to a plan happen around open enrollment. We're going to get to that next here in a second. But if you are making changes that occur outside of open enrollment, you need to send those notices. And actually, most of the time, those changes will impact the information in the SBC, and that change will trigger a 60-day advance notice. So just remember, if you're making changes mid-plan year, you probably have to let individuals know of that change 60 days in advance. So that would be kind of a little bit of an exception, but we like to mention it here when we're talking about some summaries of modifications and other changes to the plan. So with that, and again, we are going to get to some resources that track all this and outline it in different ways, including a couple of different charts and some calendars. So our NFP resources here are very helpful to be able to track the timing and which notices need to go during each of these buckets. But with that, I'm going to flip it over to Yoko to talk about our third bucket, or time frame of open enrollment.
Thanks, Chase. So this is the time of the season for open enrollment in a month or two for calendar year plan year. So you must be busy trying to see which notices need to be in the open enrollment packet and also the benefits guide. As Chase mentioned, the list in the green is the list of required notices for during the open enrollment time. As you know, SBC must be included and needs to be provided. And sometimes like the carrier may not be providing it when you hold your open enrollment. So it might be closer to your plan year. But important thing is as soon as you receive the SBC from the carrier, review it. If you verify, just distribute it timely because it has a high penalty amount as well. And a chip notice, this needs to be provided the updated version annually. And SBD, as Chase mentioned, this is important, but generally speaking, you don't distribute SBD during the open enrollment. But in case you do, SBD should be provided then. And the wellness notice that we cover also needs to be provided if you're planning to provide the wellness program that pertain to either that triggers the HIP notice of availability, reasonable alternative standard, or the EEOC notice for the 2025, include that notice or the model languages as well. And again, if you're planning to implement ICRA for 2025, just make sure to provide the ICRA notice. If it's the annual, then 90 days before the plan year starts for the second year. And for the first year, you have a little leeway until the first day of plan year if it's set up closer to the plan year launch date. And for the fixed indemnity coverage notice that we mentioned about, that's the new. And the one key things to really keep in your mind is coordination with the vendors and carriers in terms of providing the open enrollment opportunities and also the notice requirements. And sometimes you're caught up, you're busy with the active employees, but just keep in your mind to provide that open enrollment materials, required notices, also to those on the COBRA and those employees on the FMLA leave as well. They have the same open enrollment election rights as well as the notice requirements. Next slide. And I'll go through this very quickly as Chase clearly explain about what needs to be done in case of the mid-year plan change. It may not happen often, but in case you decide to make a co-pay, deductible, or network change in mid-year, then these are the requirement. These are the notices that need to be provided timely to the participants. And then SBC is more stricter requirement. If any contents on the SBC needs to be updated, then needs to be provided 60 days before, 60 days before the effective date. And SBC is the summary benefits coverage. That's the 3 to 4 pages with the graphic. And for the full insured plans and for self-insured plans, usually you get this SBC from the carrier. Carriers are the one that creating, and you need to double check and finalize it with the carrier and distribute it to the participants, eligible employees and the dependents if they were not with them. And the other than those notices that we talk about, other annual notices that require outside of the open enrollment are our ACA form 1094, 1095C. For the so 1094, the reason 1094 to the 1094, 1095 to the IRS, and 1094 with the employees for the full insured plan is a copy of 1095 to the full-time employee timely, and usually the following of the earlier of that year. So for 2024 year, you'll be distributing a copy of 1095 to full-time employees or self-insured as enrollees around the March time of next year, and filing with the IRS, the 1094, 1095 around the same timing. And in January, it's been around and rules haven't changed for those employers who file 250 or more W-2 needs to report the aggregated employer-sponsored health coverage cost on the W-2. And HSA, I think it may not apply to many of the employers because many employers sponsor HSA through the Section 125. But in case you sponsor HDHB, an HSA contribution, employer contribution through outside of Section 125, then this notice needs to be provided. And it's a time of the season again for Medicare Part D, creditable and non-creditable disclosure notice. This notice needs to be provided annually by October 14th. And we have the toolkit to assist you with the distribution Medicare Part D as well. And summary annual report. So for the calendar year plans, the end of this month is a deadline to provide the SAR to your for the employees. And one note about the Section 1095 is in case you receive the letter 226J from the IRS, the important thing is the initial penalty assessment letter. It's not a finalized penalty letter. However, it's important to review closely and respond. And if you have any questions, call the IRS on the letter indicated to work with them to clarify what that letter entails. And for the 5,500, the question that we often get that needs to be which employers who are smaller employers, whether you need to file the Form 5,500 or not. And the rule is that total number of participants, enrolled employees in the welfare benefit plan as of the first day of the plan year is at least 100 participants, including the former employees. Then you need to file the Form 5,500 for that year. Here's the SAR tips, and we have the publication for this if you have any questions. And summary annual report is the employee version of the Form 5,500 that you file with the DOL. And it's usually a page or two summarizing the plan information that you report on the Form 5,500. And it's important to also distribute to COBRA participants and then retirees who are enrolling in the plan as well. And there's also the electronic distribution rules that are noted there. I think many employers prefer to distribute electronically. So, and then next slide. And then we're going to go through in detail about the electronic distribution. So I'll just skip that part now. And it's important to, not just for the SAR, but other notice distribution, it's important for employers to retain record that you did provide which date and to whom, and other important information so that in case of the audit, you can prove to the agency that you are in compliance. You put the good faith efforts into the notice requirements distribution. And the Medicare Part D, we have the publication as well to help you guide, including some tips. An important note I'm going to go is that distribute the Medicare Part D notice to all individuals eligible for employer's prescription drug plan. And that will include the COBRA participants, retiree, and regardless of the enrollment status. And this needs to be provided by October 14th. And oftentimes employers may not know who is eligible for Medicare Part D. So the easiest or the best practice is to provide this notice to all employees instead of those certain employees who are 65 and above, for example. And the last scenario that we're going to look at, and it happens time to time throughout the year, is that upon coverage termination, voluntarily, or maybe you initiate the termination of the employment of an employee. The key is that if an employee was enrolling your plan the day before the qualify event happens, which is termination, then you need to make sure to provide a COBRA election notice unless you're exempt from complying with the COBRA. And oftentimes it's important to coordinate with the COBRA vendor if you have COBRA vendor and a carrier for the fire feed to make sure that notice is provided timely and then the coverage terminated or not terminated according to the election timely as well. And another, now the point solution and then fertility benefits like Carrots, Maven, those fertility benefits are, if they provide medical care, then just the tips is that those plans are generally subject to COBRA. So make sure that those are also addressed in that COBRA election notice distribution and as well. And for those small employers who are who may be subject to state mini COBRA for the full insured plans and small employers, so it's important to make sure that which the state continuation notice they are required to provide. And as well as the USERRA continuation coverage notice. This is not so much of a termination, but those employees who leave for work for a certain period of time for the military service, this USERRA notice needs to be provided as well, along with the COBRA usually. Okay. And next slide. I hand it back to Chase for the notice distribution methods.
Yeah, thanks, Yoko. And before we move on to that, there's several questions kind of asking the difference between an SPD and an SBC. And I just wanted to clarify that really quickly. SBC, and we do have lots of acronyms, right? And so we're always kind of trying to struggle with what do these acronyms stand for. But the SBC is the Summary of Benefits and Coverage. Remember, this is part of the ACA that came online back in 2010. The SBC was a couple years after that, but this was what started as the 4-page summary that was compared to a nutrition facts label on food. The idea was to try and simplify and boil down and make plans more easily comparable. And so the government, in trying to implement that rule, decided that 4 pages wasn't quite enough. So they interpreted that to mean 4 pages double-sided. And that's kind of where we are. So it's kind of like an 8-page document that is called the Summary of Benefits and Coverage, or SBC, that usually is prepared by the carrier in the fully insured context and the TPA in the self-insured context. And so most carriers and TPAs now are okay in preparing those and sending them out to go when they're supposed to go. That's the SBC. The SPD is the Summary Plan Description, and this is an ERISA requirement. So again, 2 different laws here. We got the ACA with the SBC requirement, and then you have the ERISA with the SPD requirement. Summary Plan Description is really meant to be a summary of the plan written in layman's terms and distributed to employees when they enroll in the plan or within 90 days of enrollment. And again, the SPD is usually something that is prepared. There are companies out there that prepare it. Law firms will prepare an SPD. NFP can assist with preparing that. But the idea there is to try and give employees a summary, a layman's terms version of what they're getting with the plan. And so 2 separate documents, but similar intent. And again, we wish they were combined when we talked about that one ring to rule them all. This is another example of where we wish, it seems like the intent of both of those documents is to help employees understand their benefits, in an easy way. Unfortunately, none of this is very easy to understand, but we ended up with 2 requirements there, 2 different documents. So I just wanted to explain that really quickly. One of the biggest questions we get, though, is how do we distribute these notices? And can we hand deliver them? Can we post them to an intranet? What about the enrollment system? Can we just post them there and have employees sign off as they go through the enrollment process? What about email? What about mail? And so let's walk through that. And really in this slide, we have kind of 3 of the main delivery methods. But before we even talk about that, I think one of the most important things when we're talking about distribution of notices is to really look at your employee base. And the reason I say that is because if you want to jump down to electronic delivery, which is probably the most simple and easiest, if you're just thinking about, can I email this to all my employees? the first step in that analysis to know whether you can email or otherwise electronically post notices is whether your employee base has access to electronics as a regular part of their job. The rules refer to that as an integral part of your job. And when we say electronics, we're usually talking about either a phone or a laptop. So in most of our jobs, we have access to computers as part of our job. We do email every single day. We are considered employees that have electronic access as part of our job. And so if you have that employee base, you can now use electronic delivery and email things to your employees. If you do not have an employee base like that, you are going to have to take another step, which is to get permission from employees to send things to their email, or you can resort back to hand delivery or mail delivery. So that's really the first step. But going through the notice distribution methods, even if you had employees that had that electronic delivery, you are still okay to either hand deliver or mail deliver notices. The challenge with hand delivery is that you would have a difficult time showing that you delivered that. The only way that we really ever see this is if you have an employee sign a piece of paper saying, as you hand it to them, that they received it. And again, this is getting back, another overarching theme here is that whatever method you choose has to be calculated to result in actual receipt of the notice. That's a fancy way of saying, make sure that whatever you're doing is resulting in this employee receiving this notice. So hand delivery feels very much like you can see that, you handing them the notice. That's pretty good proof that you did it, but then being able to show later is what we're saying is the administrative challenge. You usually wouldn't have somebody sign something right then and there. So that's the challenge with hand delivery. Mail delivery is actually the best practice. And the reason is because you could mail notices, and most of the courts that have looked at cases where they're trying to prove that you mailed it have said if you show that your processes are in place, you keep copies of address lists and notices and record the dates that the documents were mailed, you don't actually have to show or prove that the employee opened that mailbox and took it out of the mailbox and opened the letter and read the letter. You just have to show that you have the process in place. So we recommend first class mail. That's probably the best practice overall, but we also understand that that's a big use of paper and mailing costs can be substantial. So that's where we get to electronic delivery and email. Again, the other challenge here is certain notices might be difficult to send, even if you had access to email and computer or phone as part of your job. What about a former employee that you're trying to send a COBRA notice to? You can't send it to their work email because they're terminated, right? And so, and again, certain notices may not be very good for electronic delivery. The COBRA election notice is an obvious example there. And same with a mid-year enrollee spouse. So I get married during the year, I add my spouse, I've got to get that COBRA initial notice. My employer has to get that to me. And so email is not going to be the best because I do not have the my spouse's email. So those are a couple of examples of just notices that might not work for email. The other question we get here is with respect to posting to an intranet. That is where you could do that or build it into the enrollment process. But now you need to have some notice to the employee to let them know it's on the intranet or it's part of the enrollment process. So you would still need to send them some type of notice, either by mail or by email saying, hey, you have some really important documents that are available at this particular intranet site. The other part of that notice needs to tell the employee that they could actually get a paper version if they wanted and where to go for that paper version. And so those are a couple of important points when we're talking about electronic notices. We do have a publication on this. You're seeing the screenshot for it here, electronic distribution electronic distribution rules, a guide for employers that really walks through this. And so that's another great a resource through NFP. You can get that through your NFP contact. So with that idea of electronic delivery as a potential option, there are a couple of notices where you have special rules, even if the employee has access to electronics as part of their job. The Form 1095-C is an example where you need to actually get a very specific affirmation from the employee that it's okay to send that particular form via email. Otherwise, even if that employee has electronic access and you're sending other notices to them, you cannot send that Form 1095-C electronically unless you have that affirmative consent. SBC has a couple of special rules. Really says you can provide it electronically in connection with online enrollment or in response to an online request. But again, you have to provide that option to receive a paper copy for free. And so just keep that in mind as well. Record retention rules. We like to highlight this again, that ERISA really says you got to retain records for 8 years. That sounds like a long time, but if you think about kind of how the audit process works and that generally speaking, plans are being audited or looked at retroactively, it's just that idea that 8 years is kind of a general time frame to help you fall within that period of time where the Department of Labor or the IRS, if we're talking IRS, could really ask for records. So just a reminder there. And again, another thing to think about as you're distributing these notices, keeping records, noting what your procedures are, noting which notices you are sending, and is really important. So with that, we're going to move into a couple of quick FAQs. We've received several through the chat, but we had some prepared. And Yoko, I'm going to throw you the first FAQ. How should employers handle the notice distribution for remote workers? We're in that world now, like think about the FMLA and USERRA posters that used to just post in the break room. Now you got a workforce that is working from their home. How do you handle that?
Yeah, good question. So the DOL allows employers to post FMLA and a USERRA poster in the electronic format by email, as long as it's full text is captured to the remote workers. And now I'll ask Chase a question. And question is, should employers include COBRA initial notice in their new hire kits when you hire benefits guys or open enrollment guys?
Yeah, that's our answer here. And I think we talked about this one a little bit, but because COBRA rights are available exclusively to plan participants and not just those that are, only eligible for coverage, COBRA initial notices should be provided only to covered plan participants. And again, including those covered spouses upon initial enrollment. So really not not something that should go through open enrollment guides or new hire packets. So I think that takes us to our third FAQ. We send Medicare Part D creditable, non-creditable notice only to those who are Medicare eligible employees based on the age, which is a common way that we think about Medicare, right? That age 65 threshold. So if I just send it to those that are 65 and older, is that sufficient, Yoko?
Yeah, almost there, but I know some employers do that. But in order to be fully capturing all the Medicare eligible employees as well as their dependents, as you all know, the Medicare can be some employees who are under 65 can be eligible for Medicare due to disability or end-stage renal disease or other reasons. So it's the best practice or the easiest practice to really make sure all the Medicare eligible employees and dependents are receive the Medicare Part D notice is to just send it to all employees, regardless of the age. Anything to add here, Chase?
No, I think you covered it very well, and we've talked a little bit about that one earlier.
Sounds great. And so the last question I'll pose a question to Chase is that employees do not have work computers. Can we post required notices on the company intranet for access via kiosk or time clock or share computer?
Yeah, no, unfortunately, again, getting back to that idea of what does your employee base look like? If employees do not have work computers, this isn't going to be sufficient to meet the Department of Labor's electronic disclosures rules, but employees can consent to receive plan notices electronically to meet the safe harbor there from the DOL. But that consent should explain which documents will be distributed electronically. And again, getting back to that idea, they have to have the right to request paper copies of the documents. It needs to be a process to request that paper copy. We usually say that paper copy needs to be provided for free, and then the procedures for withdrawing consent. So just some additional requirements there if you're going to have those without work computers or electronic access and you're trying to get their consent to send things electronically, including just putting it on the company intranet.
That makes sense. Thanks, Chase.
Yeah, so with that, we wanted to talk just a little bit, and we don't have every single penalty for every single notice here in our slide. We do have this information available. If you have a notice that you're specifically wondering about, we can definitely find that for you through your NFP account team. But what we did want to provide is just a flavor of what some of these penalties look like. And we'll start with that SBC. We talked about that. That is a maximum of 1,406 per failure. So again, you're thinking about a failure. What does that mean? Does that just mean I didn't send the SBC to all my employees? This each miss on an employee would be considered a failure. And so you could have quite a bit going on there with an SBC. CHIP notice, that's the Children's Health Insurance Program notice, $141 per day per failure. ACA reporting, again, this is an IRS penalty. We have a $310 per failure with a max of these numbers. If you're wondering how we get these odd numbers, it's because they're generally adjusted for inflation. So 1406 sounds like an odd number. So it is a max of 3.783 million. But just giving you an idea there, when we're looking at the SPD, we didn't have a specific dollar amount penalty, but you do have criminal penalties if there's a willful failure and potential prison time. We don't say that to scare anybody. We haven't ever seen somebody actually go to prison for this, but it's just trying to provide the flavor of how the law is written. Criminal would be something, that intentionally hurts somebody. So we just don't see that very often. But Form 5500 and FMLA, willful violation of the posting requirement, and those amounts there as well. So again, not the other thing I wanted to mention is some of these notices, if they don't go out, could result in participant complaints. They could actually file a lawsuit to force you to send those notices, but also the bigger deal is that they could go to the Department of Labor, which could trigger an audit. And we have seen that as a start to a Department of Labor audit on a group health plan through failures to send these notices. So kind of all across the spectrum when we're talking about potential penalties. And again, not trying to mention that as any type of threat or anything like that, just to give you an idea of what's on the line for potential failures there. We'll finish up with just a review of our resources. We've had several questions coming in, asking for the slides, which first of all, we will send around the slides and recording afterwards. But we wanted to highlight some really helpful NFP publications and resources. So Yoko, if you wanted to jump up to the next slide, we have several publications that will outline some of these very specific group health plan requirements, such as the summary annual report or the Medicare Part D notice. I mentioned the electronic distribution rules, but we also have these two, one called Required Group Health Plan Notices Overview and Required Group Health Plan Notices Chart. And those are a little bit hard to see in the slide here, but basically they talk about, name the notice. And so you'll be able to see the acronyms spelled out in these publications, a short description of what they are, and then when they need to go and whether they might be a good candidate to send electronically. And so again, these are great resources to be able to sort of summarize everything we've talked about today. We organized our presentation today on the same sort of life cycle type of thought process when it comes to when you need to send these notices to employees. On the next slide, we also have our compliance calendars, Our calendars are they're organized by plan year start date. So think about your ERISA plan year. And the first page, which isn't shown here, will walk you through which requirements need to go during each month throughout the year. And then the second and third pages of our compliance calendars include kind of the same life cycle type of outline, which notices need to go upon eligibility or higher, which need to go at open enrollment, et cetera. And then page 3 that you're seeing there is actually links to notices that have a model notice associated with them. So these resources are really meant to make this much easier visually to see what we're talking about. And please ask your NFP contact for those resources. We'd be happy to share them and get them in your hands to help sort of organize and visually be able to see what we're talking about with these notices, because I know there's a lot. We know there's a lot here. Yoko, do you want us to walk us through our takeaways and a couple of final tips here before we close out?
Sure, thank you, Chase. So yeah, as you can see, like there are a lot of notices, but a good thing is that Chase mentioned we have a really helpful resources to guide you through, an easy, like quick look at a quick chart as well. And as you could see, like notices are required at specific times throughout the employee life cycle, open enrollment, termination, other time. So it's important to understand which notices need to be provided when. And some notices require customized notices. Some are just provided as is. For example, the exchange notice needs to be customized on the second page, for example. And the other notices, like a No Surprises Act under CAA and the group term life, it's important, and also the fixed indemnity new notice. It's important for employers who are applicable to coordinate with the carriers that carriers are doing on behalf. If not, the employer is ultimately responsible to do the notice requirements for those requirements. Anything else to add, Chase?
No, thanks, Yoko, for those takeaways and tips. And thanks everybody for attending today and for all the questions. I think we answered 45 questions through the Q&A. Thank you to the rest of our benefits compliance team here at NFP who was answering those questions. But I think we covered a lot of the questions that came in just through our explanations and through our own FAQs. But if you have additional questions, please do send them through your NFP account team or NFP contact. Again, we are happy to share our NFP resources, including those notice charts and calendars and other publications that can help with the electronic distribution and understanding that. But we're always happy to help facilitate a discussion with our team if you're an NFP client and provide resources, even if you're not an NFP client. But we really appreciate everybody taking the time to join today. And thanks, Yoko, for presenting with me. With that, I'll flip it back over to Amber to close us out here.
All right. Thank you, Yoko and Chase, for sharing your valuable time and expertise with us today. To reiterate, today's presentation was recorded. We will be sharing the recording in the follow-up email and on the NFP website. If there are any portions of this call that you missed, by Monday, you'll receive an email with a link to the full recording. The PowerPoint slides used during this presentation will be shared in the same email. At the end of this call, a survey will populate in a new window. Please take a brief moment to complete the survey, as it lets us know what topics are important to our listeners and helps make our education program as current and relevant as possible. That concludes our webinar for today. Thank you everyone for joining us and have a great day.